My name is Kelly Cronin. I'm the head technician of the Santa Fe Animal Emergency Clinic.
What are some things that people should look for when they're considering a doctor to do an amputation on their dog?
Some things that you should think about is having full monitoring equipment available. You can always ask them how they monitor their anesthesias, how their people are trained to monitor anesthesia. Most of my technicians have gone through pretty extensive training, up to years spent on anesthetic training in order to get to the point of being able to modify the fluid volumes, modify the plane of anesthesia, and really watch the plane of anesthesia. And you're also looking for someone who is really astute as far as the surgical prep and using the correct antibiotics, the correct fluid volumizers, the correct fluids. Someone who doesn't want to place a catheter is probably not going to have the safest anesthetic regimen. Someone who doesn't have all the bells and whistles is not going to have the safest anesthetic regimen. You also want to have full intubation. So as we were talking about with the tracheal tube, they always want to have an intubated anesthetic procedure that allows for the best oxygenation of your pet and also for the appropriate maintenance of anesthesia. And then you want to have nice anesthetic equipment as well. What we use routinely for our surgical monitoring is we use blood pressure monitoring, either a Doppler or Cardell, or we have a Surgivet for blood pressure monitoring, and that's for constant blood pressure monitoring throughout surgery. You really need to know that because anesthesia can and often does drop blood pressure, and so we usually have to use volumizers to keep that up. We also have EKG monitoring. We also monitor fluid ins and outs. So as far as that goes, we usually have a urinary catheter placed for watching our fluid outs. And then we also have all of our fluids on monitors as well to make sure that they're getting the appropriate amount of fluids. We also have what's called pulse oximetry, or SpO2, and that's looking for how much oxygen is actually getting to the peripheral mucous membranes. So it's telling us if the animal is getting enough oxygen, if we need to supplement it, and if we need to help the animal breathe for additional oxygen. We also have what's called the Untitled CO2, which just attaches to the tube that we place in the animal's lungs. And it looks at how much CO2 the animal is breathing off, so it tells us the depth and plane of anesthesia, tells us if we need to modify it at all in order to allow that animal to get better anesthesia and or to get lighter on anesthesia so that we can keep them at the lightest plane possible. And other than that, we also have someone constantly monitoring anesthesia. There's someone who has to always change the fluid volumes, add volumizers as needed, change the depth and plane of anesthesia, and help out the doctor in surgery.